So in January of 2020, I was teaching my fourth year medical virology course, and I was aware that there was this new respiratory virus that was infecting people in China and spreading rather quickly. And so as a class, we would watch this red dot in China get bigger and bigger, and then these new red dots were showing up in all these other countries, and we kept asking, when is it going to show up in Canada?
I think my moment was when the virus jumped from China to Iran and Italy in very short succession.
I think the data became scary at the beginning of March, where certainly more countries started to become affected. Nothing was being done particularly aggressively at that time. And then the shutdown happened and it kind of became real.
We've always said there's a pandemic-level virus out there. It's going to happen again. And we've seen examples, and I think we got overconfident. We had SARS that was controlled. We had another coronavirus, MERS, Middle Eastern Respiratory Syndrome, that was controlled. And I think we've assumed that we can control things, and we've realized that we can't.
The planning that needed to be done before the disease came to our borders did not seem to be done.
I think people realize now that any infectious disease or emerging infectious disease can affect any part of the world. And also it can emerge from any type of species. I mean, who would have thought that MERS could be transmitted from bats to camels to people? So you can't rule out any animal species, and you can't rule out the fact that it can affect any part of the world.
One Health to me is a collaborative approach among multiple disciplines as well as other societal actors, so community members, potentially politicians, those in industries, and essentially looking at complex or wicked problems that occur at the intersection of human, animal, and environmental health.
Zoonotic infections are a prime example of the One Health concept. We are destroying habitat, and that means that humans and animals are coming into closer contact. The more you destroy the habitat, the more likely you are to have this interaction, and then, again, it could transmit human to human.
This pandemic's also shown how we need this broad intersector approach to infectious diseases. It can't just be medicine and veterinary medicine, and it can't just be science. It has to be social science, it's behavior. The bigger challenges we're dealing with now are things like vaccine hesitancy.
I understand vaccine hesitancy to stem from mistrust. If we don't have buy-in from the public, if they don't trust the product, if they don't trust the policymakers and the providers, then the best vaccines may never make it into people's arms. We have a lot of access to media, and many of us have a lot of time to spend on the internet, and we got to see the mess of science, what it looks like before things are established, before things are settled. There will be people that say, you see, the scientists don't know what they're talking about, when it might be the case that they are changing their directives in light of new evidence, and that's a sign of good science.
I have found the University of Guelph to be extraordinarily collaborative, a really great environment to build relationships and do work with other researchers outside of your own discipline. I think we also have a really unique combination of expertise here. We have the Veterinary College, and One Health has really taken leadership out of the veterinary field. But we have, the Agricultural College, strong biological sciences, strong environmental focus, and then really strong social science, which is incredibly important when we think about the entire One Health approach.
Our research actually has expanded considerably after we demonstrated that our vaccine platform works against SARS-CoV-2. This is actually kind of taking the One Health approach and flipping on its side. We're taking an animal pathogen and turning it into a benign vaccine vector, which can protect humans. But interestingly, we can also use this vaccine to vaccinate production animals.
Optimizing this vaccine platform, I first and foremost feel grateful and honored to be a part of this team. The University of Guelph plays a significant role in the prevention of the next pandemic. Just incorporating or being a part of One Health is the first step towards that.
My work just deals with infectious diseases, and we're always on the lookout for something new. We really focus on that interface between humans and animals. So we track current diseases, we track what we think are emerging diseases, and we track things that are just unusual.
I think my research can help us prepare for the next pandemic in really providing more evidence and continuing the conversation on how important the environment and environmental health and wildlife health are in preventing any kind of disease event that we might see.
Health requires this kind of broad perspective, and there isn't one discipline or one researcher that can bring in all the necessary perspectives and all the necessary tools.
I think if we reflect on the entire situation with the pandemic and embrace a One Health approach in our pandemic preparedness, we can be prepared for the next one.